Welcome to the CURES Show, where we explore the cutting edge of wellness. Do you sometimes struggle with stomach pains, bloating, not sure exactly what's going on? Well, it could be something that you could find out with a simple test. I am joined now by naturopathic Dr. Jennifer Stagg, who is telling us something about SIBO. And I've never even heard of SIBO, really, but apparently it's extremely common, and we all need to know about this.
Yeah, for sure. It is really common. As we've talked about, 15% of the general population will test positive for SIBO, and that's not even like the people who necessarily have like GI symptoms.
Yeah, so let's talk about at first some of the symptoms that I know so many people struggle with and might blame it on something else. What are some of the symptoms of having SIBO? Tell us that, and then we'll find out exactly what it stands for.
Okay, yeah. So you're going to want to know about SIBO if you have symptoms of bloating, like where your belly gets distended throughout the day, and that could be, you know, it's happening every day or it's happening occasionally. Irregular bowel movements, whether it's constipation or diarrhea, abdominal discomfort, pain, some upper GI stuff, like even the sense of fullness after a meal. Heartburn could even potentially be SIBO.
Okay, so and what is SIBO?
Yep, so SIBO is an acronym for small intestinal bacterial overgrowth. So that means that in the small intestine, there's too much bacteria in there. So normally we shouldn't have a lot of bacteria, and as a lot of people know, we have like your microbiome all through your gut. So most of that bacteria should be in your large intestine, but some of it gets sort of like moved up into the small intestine, so that now you have too much bacteria, the wrong types of bacteria, and when you eat food, bacteria in that area will ferment and produce gas, and that will cause that discomfort, bloating, and even like irregular bowel movements.
So 15% of the general population will have SIBO, but 40 to 80% of IBS patients tested positive for this, and half of celiac patients who are not better on a gluten-free diet. So you might even think, oh, I'm a celiac, but I'm not getting better. You could have SIBO, and there's a test to determine it for sure?
Yeah, exactly. So if you're having symptoms of IBS, or, you know, as you said, with celiac disease and you're still not feeling better, you can ask your doctor to get you tested for SIBO. And it's a simple breath test. So it's non-invasive. It's not like you can test for SIBO with an aspiration during an endoscopy, but that's very rarely done. The way that everybody does it is through breath testing. So you're basically, you're drinking a solution of a sugar, and then and then you're blowing in tubes, and then the instrument is measuring the amount of gas produced, like hydrogen gas, methane gas, gas that would be produced by bacteria. And so if the levels are higher than they should be, then we can diagnose that patient with having overgrowth SIBO.
Okay, so these patients might be just living for a very long time with constipation, bloating, diarrhea, any of that, and just have no idea.
Yeah, absolutely. Or it can be something where they've been fine all along and now all of a sudden they're having a problem. So a lot of times we'll see that sort of presentation, and then we ask, there's a lot of risk factors for SIBO. Anyone can get it, but some people are at a higher risk, and many times it's someone who's had like a GI virus or has had some sort of like serious infection that has affected sort of the motility in the gut, disrupted things. You know, if you're throwing up, it's pulling like your whole system is going upward instead of going downward, and that reverse peristalsis can cause bacteria to move up into the small intestine. So that's a common thing that I'll find is that presentation of having had some sort of like GI virus.
Does that mean that we're seeing more SIBO since COVID because so many people had bad viruses or even affected their GI?
Yeah. Potentially, yes, because COVID in many cases can cause GI effects too. So if you actually had GI, it's a virus, so just like any virus, it can affect your gut. Some are more prone or susceptible in the gut, but yes, like COVID could definitely be another one of those viruses that could trigger a SIBO infection.
So this isn't something that your doctor's normally going to test you for, though.
Yeah, I mean, if you go to your primary care doctor and you have GI complaints, if it's anything, more complicated, they'll typically refer you to GI anyway. And so then at the GI doctor, that's where most people would actually get tested. But still, I'll often have patients who have been fully worked up by GI, and they're coming in and they just have this diagnosis of IBS, and they haven't been tested for SIBO. Wow. There's lots of doctors, GI doctors here are in our region that are testing for SIBO. And there's an excellent, one of the best experts in the country is here in Connecticut, Dr. Zacco. But we still see a lot of patients who haven't been tested yet.
Okay, so if you're sitting there struggling with IBS and having these, and I think of, my own mom, who this is how we kind of had this conversation about CURES, is you asked me had she been tested for SIBO, and as far as I know, she had not, yet she struggled with GI issues, and she's taken the probiotic, and they wanted the low FODMAP diet and all this stuff, but it could be something more than that, and there is a simple test you could also do at home. Can you tell us about, we're holding it right here, I just want to show people, what would this be?
A simple kit that you can get through a doctor. Typically, it's naturopathic doctors, integrative doctors that will dispense these at-home kits. It's the same sort of equipment that would be used for in a GI practice. That test goes out by FedEx to this company, but you're collecting the samples at home instead of in a clinic, which is much easier for a lot of patients, way more convenient. And you're basically just drinking this solution, blowing in tubes every 20 minutes for a couple of hours. You eat a really bland diet the day before. Then once we get the results processed based on that outcome of if there's too much gas produced, the two types of gas, we can tell whether it's hydrogen predominant or methane predominant, and that can sort of guide us even a little bit more in detail of how to treat it.
Okay, so let's talk about the treatment. Once you decide, hey, can I get this test, and you might get it from your gastrointestinal doctor, or perhaps you can get it ordered and do it at home, which is a little more convenient than going and blowing in tubes for a few hours. So there's two ways to treat it?
Yep. Yeah, so you can get a treatment with antibiotics, so there's a specific antibiotic protocol for it. And then there's herbal antibiotics. So you can use herbal antimicrobials, and they have been clinically shown to be just as effective as the prescription. So a lot of people don't like to take antibiotics. There's certainly a time and place for antibiotics. Some of my patients choose to go antibiotic route, and I'm supportive of that as well. But there are great natural solutions here that are clinically shown in a Johns Hopkins study to be actually a little bit more effective than the prescription antibiotics.
So those are on the table here too. These are all, again, these are not something you're going to go pick up at the local drugstore and just say, I'm going to start taking this. These specifically are by a company called Metagenics. They have super long names, but there is a protocol, and then this is a different company?
Yeah, Biotics. So Metagenics and Biotics were the two companies that the herbal antimicrobials were tested in this clinical study and cleared 46% of cases fully after a month on it. And then the prescription antibiotic cleared 36%. So it was a little less. That people might.
Would you ever do both?
Yeah, so sometimes, and so in that study, actually, the patients that failed the prescription antibiotic treatment, then they did a second round where they put them on herbal antibiotics, and about 60% of those then cleared on the herbal. So
I mean, herbal antibiotics, I'm guessing a lot of people haven't even heard of that. But basically, there's certain herbs that kill bacteria.
Yeah, exactly. And I don't want to get too complicated here, but then there's also something called fungal overgrowth. So SIFO, small intestinal fungal overgrowth. So some people are dealing with more of a fungal overgrowth, or it could even be a combination. So their breath test could actually be negative, and it's actually fungal overgrowth.
Okay.
This gets a little more tricky, but a lot of people could have both, and the herbal antibiotics clear bacteria and fungus versus a bacterial, like an antibiotic, is only going to work on the bacteria.
Okay, so another option for treatment is a liquid diet, but again, you're not just going to go do it yourself.
A very specific liquid diet. So this particular diet is called Physician's Elemental Diet. And that has been clinically studied as well. There's a big commitment here. You're drinking just like a liquid shake for all your meals. You can have water as well, but no solid food for 14 days.
Okay.
But the clearance rate is 80 to 85% on that. And I've had a lot of patients. I have patients that do a lot of different options here, but I do have plenty of patients who went the elemental diet route, and sometimes they feel so much better. They're like, can I stay on this? Like, no, we're going to take you off of it. We'll get you back on food, and you're going to feel better because it's getting rid of the bacteria.
Okay, so that's the other thing is if you're just learning about this, then the point of doing it would be to feel better. What happens after you clear this?
Yeah, so once you clear it, a lot of people could be totally fine, but then there are some people that continue to have recurrences of it. And so then they're getting another round of antibiotics, or we're putting them on another round of the herbal antibiotics, or if they've done one of these, then we're doing an elemental diet. So you definitely get some patients that, are resistant to treatment. It could take multiple rounds. And then you can get people who are better for like 6 months, they're great, and then their symptoms slowly start coming back. So as naturopathic doctors, we really look at, all the different potential causes. So we're looking at, like, does that person have sort of slow motility anyway? We have to work on, like, getting their bowel moving more regularly, which would predispose them. Some people have low stomach acid, which is something that is not talked about a lot, and that can be a contributing factor. Or they have like low digestive enzyme function. And so then we're assessing all these other factors and then addressing those too to prevent those recurrences.
Okay.
Yeah.
And so that would be the point of looking at this holistically.
Yes.
Is if you go to a traditional GI, sometimes they're amazing at what they do.
Yes,
colon cancer, all of those things. But sometimes when it comes to like what's wrong and how do we rebalance your gut, that's the specialty that you guys are really great at.
Right, yeah, and we're looking at it from all those different factors and even looking at the impact of stress. And so we're recommending specific supports for managing stress, because that can be another big factor where it keeps coming back. They seem to be doing everything else right, but it's just like they're not managing stress well in their life.
Okay. Is it more common to have SIBO in men or women, and can kids get it too?
Yeah, I mean, kids can definitely get it. Like, I have teenagers in my practice that I've tested and treating for SIBO. And then in terms of men versus women, yes, like both genders deal with it. I haven't really looked closely to see if there's any sort of increase. I mean, with IBS, it's more common in women. So
yeah, so that is true. Women are more have more IBS.
Yeah.
Okay. Yeah, because I mean, that is something that I think so many women, especially after maybe post 40 or something, at least I know in my own family, my mother, I don't remember having it. She used to say she could eat anything, stomach like iron.
Right.
But as people get older, they start having these digestive issues.
Yeah.
And if you don't feel well, you really don't have any energy to do anything else. So it's a snowball effect.
yeah, for sure. It is really common as people get older to have like lower levels of stomach acid, lower levels of enzymes. Those are all things that we would think about, and that's why older people can also be at risk of nutrient deficiencies as well.
So let's talk about the stomach acid for a moment. You mentioned that a couple of times.
Yeah.
What does that actually mean?
Yeah.
And what do you do about it?
Most people know about too much stomach acid, right?
That's when you have heartburn?
So that's when you have like classic heartburn, you're producing too much acid, you're put on a proton pump inhibitor or an acid blocker, and that is pretty like widely known. The flip side of that is not enough stomach acid, and in really small percentage of cases, that person could present with having some heartburn, which is kind of unusual.
Yeah.
And typically, like, we wouldn't just, and so in terms of treating it, there are a lot of different ways to treat it. You can treat it by using bitters, so like bitter herbs, bitter drinks, and bitter food to increase the amount of acid your stomach is producing. But you can also take supplemental stomach acid, so basically a pill of HCl that you would take along with your meal. this is something I wouldn't suggest people to just do on their own. There are a lot of contraindications for that. You really want to work with a knowledgeable functional doctor if you're going down that avenue of thinking about that.
And one of the reasons we do this CURES show is when we're talking about functional doctors like yourself, and Connecticut is rich with them, so that's great. We have a lot of different perspectives. You absolutely work with the primary care or the GI, but the difference is what you're looking for is what's the root cause of this.
Yeah.
So how do I fix it? So rather than trimming the weed, you want to pull the weed.
Right, absolutely. We're always like trying to go as deep as possible. And a lot of times there are multiple different factors going on. So it's not always just like this silver bullet, oh, we found the answer, it's just this, because we're complex, we're humans. We're incredibly complex, so there's often a lot of different factors, so it gets complicated. So we're working on a lot of different factors like stress and hormone dysfunction, and the list goes on. But gut health is so key to everything else that goes on in your body.
Yeah, I mean, so it's really, gut health can impact your mental health, your well-being, your digestion, all of it, because all of our neurotransmitters are made in our gut, right?
Yeah, exactly. So that a lot of times when patients come in with depression or anxiety and mood disorders, we're like looking at their gut health as well, right? Which is kind of like an odd thing at first, but when people start to understand how, yes, neurotransmitters are made in the gut, a lot of depression now, the more modern thinking is that it's inflammatory in origin, and so then we're looking at gut inflammation, brain inflammation, all of those things combined.
Which is interesting, because people say, oh my gosh, what am I, but one of maybe some of our listeners follow Dr. Sarah Gottfried, who I know you know, on Instagram, and she recently posted, after being trained at Harvard and MIT, that she used to think toxins and inflammation were sort of could be a factor after all these other things, and now that she thinks that it's the driving factor, and trying to detox people and all this. But because I think some people might think, oh, come on, I don't need to detox or whatever. This is just someone trying to make money, and I don't really need to do this.
Right, yeah.
It's not what our body already knows how to do.
Yeah, but it's like the science is really catching up with all of this now. If you read any medical journal, it's all about inflammation, gut health, toxicity. It's just everywhere. So you can't kind of just put it in the background any longer.
Right, which is great that there's some agreement. I actually thought it was interesting when I took my mom to her GI appointment for the first time. They said, no, don't do any of the Metamucils and stuff that we used to tell you. We want you to start taking your probiotic. And I'm thinking, well, she's been taking a probiotic for a long time because of people that I interview like you. Yeah. But sometimes, and again, this is not to criticize, but sometimes the traditional medical model, which can be so important when we have a serious thing going on, it takes a little longer to catch up because of the way they study things.
Yeah, absolutely. And so I think that's exactly what it is, that there are really driven standard of care protocols that take a while to get updated.
And it might be like a 10-year gap.
Yeah. Yep.
Okay, so back to SIBO. If you just want to have a little review here, again, let's just go over the symptoms again, so people thinking, I know everyone's listening, do I have SIBO? I mean, and the fact is, the statistics you're telling me about, a lot of people have this.
Yeah, for sure. It's very common, and often if I'm testing someone, it's very likely they're going to be positive, because now I'm suspecting that they have SIBO. We don't just test everyone that walks in, so the positive rate is very high if I'm sending a patient home with a SIBO kit.
Okay.
Right.
So, and I'll get to the symptoms again in one more second, but let's just say you're sent home with this. And again, this home test is probably not something your regular GI is going to give you, or the regular.
No, they will typically send out, and you would just do it at a local GI practice.
Which you're fine with.
Yeah,
that can be really good.
We will routinely send out as well. And so that will be covered by insurance. If you're doing the kit, you're going to pay out of pocket. But a lot of times people are like, well, I'd prefer to pay out of pocket. It's about $200, so it's not super expensive. And it is, if you're paying a high deductible for your insurance, you might be paying more, actual out of pocket when you're getting the in-person test done in the office.
So it also will depend on what kind of insurance. Like if you've got, if you're on Medicare or something, you might want to go the traditional route if you've got the time. But if you're working and all these things, and this is what's going to happen when we open this. And what is in here? I don't know if I'm supposed to open it, but what's in here?
There's a set. So there are tubes that you're basically going to collect these tubes. There's an apparatus that you're just basically going to breathe through and then attach the tubes. And then there's a little powder that you mix up in solution and that you drink that morning. So you eat a bland diet the day before, you fast overnight, you drink this solution. Well, if you take your first sample and then you drink the solution, and then you're going to take your samples, like serial samples, so we can see what's happening over time in terms of like the gas production.
Is it complicated for someone to do on their own?
It's not at all, and this company is really great. They have, you know, a video link that you can like actually watch a video. So we do a lot of different testing through this company, and the video links are really key. But there's, you know, very detailed.
We've all gotten good at swabbing our noses for COVID, so
That's
we
right.
can breathe in a tube, I guess. And then some of these instances would be this particular protocol. How long will it take to get, if you know you have it, how long is it going to take to get better?
Yeah, so we tend to do a 30-day treatment, and that's what has been shown clinically with these two products, Biotics and Metagenics. The other thing about naturopathic medicine, is that we add on like extra things. So we will add on things like biofilm disruptors. Here I'm throwing out another weird term.
I don't want any biofilm. You better disrupt that.
So bacteria will grow in what's called a biofilm. So it's kind of like a mass of bacteria. And so to break down that structure, you basically use enzymes to break that down. So although we're using like plant medicines that are antimicrobial, if you use a biofilm disruptor on top of it, you're kind of breaking down that structure, and then the herbs can be more effective. So we even do these additional add-ons above and beyond just the herbal antibiotics. And then we may have people on a digestive enzyme just like to help digest their food while they're on that protocol. We might be giving them magnesium as well to help with their motility if there was someone who was like constipation prone and they were going multiple days without a bowel movement. So there's a lot of other things that we might also do.
Yeah. What if they're already on medications for things like IBS, like maybe they're taking something like Linzess or one of those things? Can they still do all this?
Yep. Yeah, absolutely. So you can still treat it along with other GI medicines.
Okay, so it shouldn't prevent you from doing something like that.
Right.
So the bottom line is we need to know what SIBO is. And what does the acronym stand for again?
So it's small intestinal bacterial overgrowth. So the SIBO. And then there, as I said, there's CFO, which is fungal overgrowth.
Small intestinal fungal overgrowth.
Which is like, that's becoming more of a recognized condition. SIBO is still under-recognized. CFO is way under-recognized, but that's an issue too.
Okay, so these are things you need to bring up, and they could be very common symptoms that you might think that you just have to live with.
Yeah,
like
absolutely.
The gas, the heartburn, the digestive.
But the classic like distended belly, like you'll hear, you know, you could have friends that complain about like they're fine when they get up, they start eating, and their belly starts getting big. They'll complain like, I feel like I'm 6 months pregnant, and they just have this like tight distended belly versus someone who's always bloated. So if someone is just like chronically bloated, yes, they could have SIBO, but like a very classic presentation of SIBO is that like the belly gets distended more as you go throughout the day.
Or what about right after you eat versus?
Yeah, exactly. Like it's kind of like they'll say, okay, right after lunch, like maybe their breakfast is kind of light and they're not so bad, and then they start having like more food, and certain foods, the high FODMAP foods, which have like different types of carbohydrates in there and fiber, then they're going to cause like more SIBO symptoms, like more distension, more discomfort. So some people will go on these low FODMAP diets, which while they're on treatment, then yes, like in some cases we'll do dietary modification along with it, but they're not going to cure it just on its own. Like that would be really uncommon that you could just like go on a low FODMAP diet and this would be better without doing any sort of herbal or prescription antibiotics.
And I just want to talk to people about what low FODMAP diet would be. And I'll do a time check with Marnie too, just how much time we have left, but with our director to see if you can go over this. But low FODMAP, you might be hearing that from your GI. So
yeah, and that can be helpful for a period of time, but it's reducing things like onions, like cutting out onions and garlic, cutting out some cruciferous vegetables, or eating very limited amounts of it. So it's not like it's just like cutting out sugar. The low FODMAP diet itself is hard, it's strict, it's hard to follow. You're cutting out foods that are like actually good for you. And once you clear SIBO, you should be able to eat all of those foods. We don't want people like not eating cruciferous vegetables, like they can't eat leafy greens and things like that, or like can't eat garlic or onions.
Right, that's
those are things that are actually
you.
Good for a healthy microbiome.
Okay, so also if someone's going, gosh, I just can never have garlic and onions, I have the worst stomach ache, does that mean that
that could be an indicator of SIBO? And then certainly some people can be truly sensitive. There's a genetic, like truly sensitive to garlic type of situation. It's not that common, but that's like a separate thing.
Yeah.
Or some people could have an actual food sensitivity and some of these foods are bothering them and they don't have SIBO.
Okay.
Yeah.
And so it's so important because, again, our gut control is not just how you're feeling, which is important. You know, I know some people just struggle and they're taking their Tums every day or their over-the-counter stuff, but you want to get this fixed because it can lead to just so many. If it goes untreated, what's the risk?
Yeah, I mean, it can end up like you can have a lot of like nutrient malabsorption. You can have a host of different things happening in the gut that, you know, chronic inflammation, those factors that sort of just snowballs out of control, I would say.
Okay, and the risk factors, again, if you've had some sort of a stomach issue going on.
Yeah, so that's what I see like very commonly, but even taking acid blocking medications like the PPIs can put you at risk of having SIBO. And certainly there are some cases like people who have had esophageal cancer, they have Barrett's esophagitis. I wouldn't say like, oh gosh, go get off your PPI. They need to be on those medicines. But a lot of people are on a PPI and forever and have never tried going off of it, and it could be creating more problems, right? There's a lot of studies on long-term use being
And so the protocol, you actually do also, I know, help people get off because you can't just go off your acid blocker or you're going to be in too much pain.
Yeah.
So there's a protocol that functional doctors will do to get you off so that you can be off of it.
Yeah.
In closing, we've got 2 minutes left. Is there anything we can do to prevent SIBO?
Yeah, so in terms of prevention, like some of the main factors are managing things like stress. Obviously, you know, your environment puts you at risk of all sorts of chronic illness and disease. So managing stress is always important for pretty much everything. But eating just like a general healthy diet so you do have a healthy microbiome can be helpful too. So not eating like a ton of sugar, that's really bad for your microbiome in general. And it will allow everything that's like not so good to flourish.
Yeah, I'm trying to tell that to the teens, right?
I know. Oh, gosh.
Maybe they're lucky that they're young and they have more SIBO eaters. I don't know.
Yeah, for sure.
Okay, so people can find you also on social media at...
Yeah, at Instagram is at Jen Stagg with one N, and then on Facebook as well.
Okay, and Whole Health LLC, right in Farmington, Connecticut.
Farmington, yeah.
You take insurance?
And we take most insurances. We have, there's 3 naturopathic doctors there, and so we can take new patients and help people understand and figure out if they have SIBO or not.
And your husband is a chiropractor there too. It's a family business. So I've been there. It's a great place. So something to definitely know about. Mark this, save it, maybe send it to your loved one who's been struggling. See if this resonates with them. We've just learned a lot here and hopefully given you a lot of solutions on the cutting edge of wellness. So thanks for being here for Kara's Cures. I like to share this content on social media as well. So you can follow me at Kara Sunderland on every platform. We'll give it there. It's also, of course, a podcast. If you're watching on YouTube, you can listen to this on Apple or Spotify or your favorite podcast platform. So have a great day, everyone, and be well. Thanks for being here.